My name is Robert Robinson, and I had lung reduction surgery.
My name is Nancy Bettis, and I am a lung volume reduction patient.
I used to acquire pneumonia and bronchitis several times a year on antibiotics to clear it up all the time.
When I'd walk just a short distance, not even a half a block, I'd be out of breath and be looking for a place to sit down. And when I was on oxygen, I'd be turning the oxygen up, and it was miserable. I wanted more out of life than what that was letting me have.
Not being able to breathe, I don't know, it's kind of like having your mouth covered, your nose closed shut, and it's just a struggle, just each breath in and each breath out.
It comes to the point where you're almost going to a panic. It's very uncomfortable. You feel like you got a chain around your chest. Just can't breathe. I would get up and maybe go to vacuum the floor. I'd get probably a half of the living room vacuum, and I'd have to sit down and catch my breath, get my cell belt back up, get up and do some more. And I was, everything you did just part of the way. You could never complete any task. And I got tired of it. I wanted more out of life than that.
And it finally got to the place where I had to even have the oxygen in the shower with me, because I couldn't go long enough even then to just get a shower done without the oxygen on.
I was tired of living where I had to carry a metal canister around, and I couldn't move about free enough to do things I want to do.
My pulmonary doctor was treating me for pneumonia, and he was struggling to try to get it to clear up to where I could breathe. And he suggested at that time that I might have the numbers to qualify for lung reduction surgery.
And I finally asked my personal doctor to give me a little better recommendations and different doctors, and he referred me to this lung volume reduction procedure.
At first that was kind of scary because I didn't know where I might have to go, and we were so fortunate to have him doing the surgery right here in Springfield. I could tell the difference as soon as I came to from the surgery. I could tell the difference right then.
When I really realized, hey, it worked, is when they came and took the oxygen out of my house. Had it nowhere around me. I was able to do things again. I got out of the hospital on the 19th of December, and I went back to bowling in February. Before surgery, I was actually, I was not going to continue bowling. I was going to give it up. I was falling so far back that I couldn't handle it. And since I've had the surgery, I'm back to bowling 4 times a week. I've gone back to work. I work 4 days a week. And I'm getting ready to go right now to Reno to bowl in a national tournament. That was my goal before I ever got into this, was to be able to continue bowling. And yeah, I don't sit around waiting for it. I go do it.
I go to the YMCA now. We try 4 days a week. Sometimes our weeks get hectic and we don't be able to do that, but I don't remember exercising and enjoying it as much as I do now since I left the military in '71. But now exercise doesn't bother me any. You know, I think I could probably ride a bike, I don't know how far, but probably a good distance without having to quit. I can walk, it seems like forever, and I can remember tiring so easily.
If something happened and they told me I had to have the surgery again, I'd be waiting at the door. I mean, it's made a tremendous difference.
You know, it's like I'm a walking miracle. You know, that's the way I feel about it. I was blessed with a second chance at life.
The doctors, the nurses, everybody around me was just like, I called them my earth angels. Without Dr. Hazelrig and everybody that worked with it, I wouldn't be doing anything right now. I'd be sitting watching TV. And To me, that's not life.